Watch this.
In 3 days, Idaho's largest school district heads back to in-person classes. And in one day, the Board of Trustees in that district will either decide to make masks mandatory or stick to the optional plan. This decision comes as COVID hospitalizations continue to rise in Idaho, as do infections among our kids. And one pediatrician hopes the West Ada School Board hears what he has to say. The Idaho Supreme Court certainly heard what Reclaim Idaho had to say, overturning a new law that makes it more difficult to get initiatives on state ballots. It was supposed to require signatures from all voting districts. Well, all justices said it was unconstitutional. To get underway in Idaho's largest school district, West Ada, where masks and the mandates to wear them to help stop the spread of COVID-19, they were a constant concern during the last school year. Parents protesting or rallying at school board meetings, social media pages attracting hundreds and thousands of followers on both sides of this issue. Well, new year, same issue. Only this time around, the district is going in without a mask mandate in effect. They are leaving it as an optional choice for teachers, for students, and for staff, regardless of vaccination status. There's a chance, though, that could change because tomorrow, 2 days before classes begin, the West Ada Board is going to meet to discuss COVID protocols, and they're going to weigh possible changes to the current plan. So is it possible the district goes from recommending masks to requiring them? To this point, we haven't heard much from the Board of Trustees members, I should say, other than what we've heard them say during those meetings. For some insight on what is expected to be a contentious and, of course, a crowded board meeting, Joe Parrish spoke with West Ada Board of Trustees Chairman Amy Johnson, as well as District Superintendent Dr. Derek Bubb. For starters, here is what you can expect tomorrow night.
There is a lot of information floating around in our community right now around facts and data and information, our hospitalizations, our child severity rates, our spread rates around COVID. And then we also have a number of parents in different family situations. And so what we want to do for sure before we start the school year is have a good community discussion around where we're at and where we believe we should start the school year. And the way that the public process works for school boards is we can't have that discussion without doing it in a board meeting. So tomorrow night's board meeting is for us to sit down, have that conversation. We're going to have medical professionals there. Dr. Souza from St. Luke's Hospital is going to join us. Dr. Bubb is going to walk us through some different options that we have. We're going to hear from our community members, and we've been hearing from them already, both in emails as well as we've actually got some video chats that have come in. And then we're going to hear from them. And then the board and the administration, we're going to have a discussion and we're going to figure out if we need to change where we're at from our policies. And if we do, what we want to change it to start the school year on Thursday.
And will that decision be made tomorrow night, or will it be considered tomorrow and then, I guess, quick action before Thursday or maybe even after Thursday?
So to be honest, the answer is, I don't know, because we don't have to make a decision to change where we're at. Right now, our policy allows Dr. Bubb to change our mask policy at any point. So the board doesn't have to make a decision, but we haven't as a board even been able to have a conversation together with Dr. Bubb to do that. We have to do that in a public open meeting. So the answer is, we can make a decision tomorrow night, we don't have to. If we believe we're comfortable with where we're at and where we want to go, we can end the night just like that as well. We want to make sure we have the discussion and we do our due diligence as a team, and then we'll decide and we'll move from there. Whether or not a decision needs to be made will be up to the discussion and information.
I guess in general, from your perspective, both of you, the reaction from parents, no matter what they support or what they're against. I mean, what's your take on, the passion, as you highlighted? You're getting video messages and emails and thousands, I'm assuming.
Yeah, I would say, and I've said this before, this is obviously a divisive issue. I hope that at one point we can look at this in the rearview mirror. I think everybody hopes that one day we can look at this in the rearview mirror, but the passion in education is something that we need to be able to capture, and we need to be able to use towards educational needs for our community. I look forward to the day that we're sitting here talking about the amazing educational initiatives that West Ada is introducing. I think those things are happening as well. This happens to be a hot topic right now, and I understand. People want to be involved, and we need to be able to capture that involvement and make sure that that we use this as a catalyst to move forward in our district.
For the board and for you, Dr. Bubb, how has this been for a leadership perspective in terms of dealing with this? There's a ton of focus on it, of course, from the media and the community. And I'm just curious, from an inside perspective, kind of what dealing with all this has been like.
We've got, myself and the board have gotten to know each other really well over the last 30 days. So, it's obviously a challenging situation. There's no easy answer there. You can see this across every governmental agency, not just in Idaho, but everywhere. People are battling with this. I think it's created a solid foundation of communication between myself and the board, where we can really use that again to move forward at a future time where we can finally put some of this in our rearview mirror.
I think one of the lessons you learn when you get in these roles is that we're both parents with kids in the West Ada School District as well, is that making the decision for our individual kids is really easy. Making the decision for everybody else's kids is really hard. And there's a lot of sleepless nights and a lot of up and down and a lot of back and forth trying to figure out how to do this right. And frankly, we try as hard as we can to make sure that we want to make it work for everybody. And we know that's not possible, but that's still something that we individually and as a group collectively try and achieve.
Dr. Bubb, I know that earlier this summer you were given, essentially unilateral authority to make major decisions, operational decisions. For you, is there a turning point where it would be a metric or a piece of data or public outcry that you would say, okay, we are going to require masks? There is a point to where I'm keeping my eye on, and when we hit that point, for me, I have to make a decision.
Yeah, obviously, as the policy says it, the board put a policy in place that gave me unilateral, if that's the word you want to use. But I think that the really important thing here is that the board and I work really closely together, and we work with our medical professionals to determine what is the best environment for our kids and the safest environment for our kids. So that is really a catalyst of this conversation to say, hey, this is where we're at today. Obviously, things have changed. In regards to numbers and things like that. I think it's good to have a good, healthy, honest, open conversation in a public forum where people can hear where we're at. That's the most important thing. As we learned last year, being flexible is the new skill that we put on our resume, and we really have to exhibit that right now.
All right, Joe, so it sounds like to me the West Ada School Board trustees gave that determination to the superintendent to make that determination, school by school, district wide, whatever, when it comes to masks or anything when it comes to COVID protocols. But there's a chance they could kind of take that back tomorrow night, if I understand that correctly, and make the decision as a board, right?
The way I understood it, Brian, is that they gave Dr. Bubb the ability to act on his own, but they didn't say, okay, you're the only one that's going to be in charge of these decisions. The Board of Trustees, as we heard from, they're going to have an opportunity to make whatever decision they find fit. I think the reasoning for giving Dr. Bubb the unilateral authority, as I put it, is just in case something does escalate quickly and they do need to act quickly. As it was highlighted in our story, the Board of Trustees, they have to meet in public to have conversations and make decisions. That's how open meeting laws work. So they can't have back channel conversations and then have to wait a day or two if something urgent comes up.
Okay, and they're moving that meeting to the White Cloud Auditorium, by the way, because it's about 3 times as big as their normal meeting place, and they're only giving people about 2 minutes to speak. So it is going to be crowded, and of course, as you said, it's likely going to be contentious as well. Now, among those things being considered by the West Ada School Board, as you heard Chair Amy Johnson say, when it comes to whether or not to make masks mandatory throughout the district, one of the elements is going to be medical expert opinion, as it should. After all, we're still in the middle of a global pandemic, and a surging health crisis should warrant some sort of input from health professionals. Last school year, the district turned to Dr. David Pate, the retired CEO of St. Luke's Health System and a member of the governor's coronavirus working group. They even considered him a consultant. However, Dr. Pate stepped away when he considered the district going against what he'd advised, like universal mask mandates, something the school board removed back in June. But they are still taking input from local doctors. That advice is now coming from Dr. David Peterman, for one, the CEO of Primary Health Medical Group. He told us today, in their clinics, they've tested 150 to 200,000 people for COVID since this whole thing began. And they're getting busier these days, he says. They've gone from fewer than 100 COVID tests a day back in early July at Primary Health to 600 to 700 a day now. Dr. Peterman told us some other startling numbers related to COVID-19. that he also shared with the West Ada School District. The goal for positivity rate, lower than 5%. We've been talking about this since the beginning of the pandemic. We are now close to 20% positivity rate in Ada County, where kids were much lower when it comes to positivity rate back in July. For 5 to 12-year-olds, it was like 2 to 3%. Well, it is now 13%, according to Dr. Peterman. 12 to 18-year-olds went from 7 to 8% in July to nearly 20% right now. In early July as well, the number of kids from ages 5 to 18 testing positive, about 7 or 8 a week. Last week, Primary Health had 123 positive COVID tests in that age group, a 15-fold increase. His concern, what happens 4 weeks from now with a more contagious variant and with kids in school without masks, what are we going to see? We could see positive cases in kids in the thousands, Dr. Peterman says, which is why he said this to the West Ada School Board and Superintendent last week.
Putting this all together, my strong recommendation, consistent with the American Academy of Pediatrics, is there should be universal masking for both staff and children that are attending school.
We get this question a lot when we start talking about this stuff. Show us the data. What data are you basing this universal masking recommendation on?
So there are somewhere between 100 and 150 research projects from around the world that support the effectiveness of masks. But the best study is right here in the United States. The legislature of North Carolina commissioned a number of experts, including physicians, epidemiologists, to look at over 1,000 schools and 1 million children in North Carolina. And again, some similarities to Idaho because you have urban, rural, some college towns and whatnot. Here's was their findings. Number one, distancing, not that effective. Hand sanitizer, not that effective. When you institute voluntary masks, not very effective. But when you have mask mandates, when you require children and the staff at a school to wear masks, it is very close to having vaccinated those children and staff, of course, those that are eligible. So there is very clear data that masks work.
That's pretty impressive. I mean, I was looking at some of those numbers in the North Carolina study, and to say that it is almost as effective as getting vaccinated, that's a pretty profound opinion, I would say.
Yes, and I feel a very, very strong obligation as a pediatrician, again, to present the facts of what's going on here in Idaho and present the facts to these public officials that masks work.
A lot of parents, and I know this isn't necessarily your expertise, but as a pediatrician, this call of masks being psychologically damaging to kids. Do you buy that?
The American Academy of Pediatrics, which is made up of hundreds of thousands of pediatricians from all over the world, has stated unequivocally that there is no association of masks with any emotional detriment to children. And in fact, they made this statement that masks does not cause any harm in terms of children's development, language. And so there is no evidence, not credible evidence, that masks in any way are harmful to our children. And I don't mean to make light of parents' opinions. I recognize every parent has their own opinion on how to raise their children and whatnot. But as relates to their health, we need to listen to the experts beyond myself. And there is very, very clear. The American Academy of Pediatrics recommends universal masking for both children and staff in schools to not only keep the children healthy, but the staff.
All right, I'm going to put you in a tough spot. And I know I said I didn't want to, but I'm going to put you in this tough spot. Should the West Ada School District be making this decision based on popular opinion or based on medical experts' opinion?
Well, yeah, you are putting me into a position. Yeah, again, my role is I don't claim to be a political official. I don't claim to be on the school board. This is not a political issue. I'm providing medical fact. The facts is that Delta virus is absolutely running rampant in our community. Number two, we don't want it to spread among our children like Florida, Arkansas, Louisiana. The best way to stop that, the scientific way to protect our children, the teachers, and our community is for universal masking.
So that North Carolina study Dr. Peterman referred to is this ABC Science Collaborative. It was done March through June of this year. North Carolina, similar to Idaho, as you heard Dr. Peterman say, both states have 115 school districts, cover urban and rural areas. Idaho is about a third of the number of students out there, though. This Carolina study had 100 school districts reporting, more than 1 million students and staff participating. They called it Plan A, full in-person instruction, minimal physical distancing, and mandatory masks. And by June, about 1 in 3,000 students in school buildings got COVID, so about 300 cases in 4 months. And they came to this conclusion: proper masking is the most effective mitigation strategy to prevent secondary transmission in schools when COVID-19 is circulating and when vaccination is unavailable. Plan A, full in-person instruction, is appropriate for all grades, all schools, when masking is in place. So that's kind of the conclusion they came to. The West Ada School Board is going to meet tomorrow at 6 p.m. to discuss masks in schools. It was a controversial bill from the start, and after months of back and forth, Idaho's Supreme Court issued a unanimous ruling on Idaho's new ballot initiatives bill. Turns out we're going back to the old way. Well, if you're new to the 208, we don't shy away from controversial subjects. Is there something you want us to dig into? Or maybe a perspective we haven't yet considered? Tell us about it. Text us your ideas to the number on your screen, 208-321-5614. Or maybe you just have a comment about today's show. Well, just make sure you include your name and the hashtag #the208. It was one of the most discussed and debated bills in this record-setting legislative session. Ultimately, lawmakers and the governor decided, to make it more difficult to get a voter initiative on an Idaho ballot. That was the way to go. Today, the Idaho Supreme Court disagreed with that assessment. The unanimous ruling, which overturns Senate Bill 1110, it claimed it was unconstitutional. Before this session, groups had to collect signatures from 6% of registered voters in 18 of Idaho's 35 legislative districts. Senate Bill 1110 made it so signatures are required from all 35 districts and 6% of them. Not an easy thing to do, which is why, almost immediately after it was signed into law, Reclaim Idaho, the same group to get Medicaid expansion on the ballot back in 2018, they filed a lawsuit against Secretary of State Lawrence Denny to stop the bill from becoming law. Today, the Supreme Court agreed with Reclaim Idaho. Yeah, the law does make it more difficult to get voter initiatives on the ballot. And in their opinion, by giving every legislative district veto power over qualifying initiatives and referenda for the ballot, the ultimate effect of Senate Bill 1110 would be to prevent a perceived yet unsubstantiated fear of the tyranny of the majority by replacing it with an actual tyranny of the minority. Essentially, one district could determine if an initiative gets on the ballot or it misses it completely. All 5 justices signed on to that ruling. Not that everyone outside of the court agreed, of course. Speaker of the House Scott Bedke said this after the announcement: these changes to the voter referendum would have served to increase voter involvement and inclusivity, especially in the corners of the state too often forgotten by some. We believe all 35 legislative districts, every part of Idaho, should be included in this important process. Ultimately, the Supreme Court apparently disagrees, and they are involved in the process when they actually get to vote on whatever initiative makes it to the ballot. So he's saying they're not mad, they're just disappointed. The court has restored the previous version of the law, where groups, again, need to collect 6% signatures from registered voters in just 18 of the districts. The opinion also ordered the state to pay Reclaim Idaho's attorney's fees, which I guess it's a good thing lawmakers voted to replenish that legislative legal defense fund with $4 million this past session, an account that seems to have a lot of withdrawals lately. And this is a live look at the Western Idaho Fair. You can almost smell the Pronto Pups and the elephant ears, can't you? Yep, the Western Idaho Fair canceled last year because, of course, COVID. But it is back this year. We're going to be down there. Members of our team are going to be down there through the News at 10 broadcast. Reminder, though, social distancing and masks are encouraged, not required. But being back this year, it brings back all the fair food right along with it, doesn't it? And the activities that threaten to throw that food from your stomach at some point. And that would be the traditional carnival rides like the Zipper and the Scrambler. There's also a petting zoo. Check that out. And what's called a jetpack circus, which seems to go well with the Rocket Man human cannonball. Both seem to launch humans high and in some cases far into the air, 65 feet by way of the cannon, by the way. None of that interested Bobby in Boise, who on Friday texted in and asked us this. Inquiring minds want to know, why is there a chairlift at the fairgrounds? Can they be ridden by the public? And if you've been down there years past when it was first put in, yeah, it was put in about 2018. The Sky Ride, they called it, opened it back in 2018. Basically like a ski lift, just you go right over top of the fair. one of the slower rides at the fair. 74 cars run on that line, which is about a mile long, and it takes you about 10 minutes to get from one side to the other. Not included with the wristband purchase, but you can pay extra if you want to ride on it. $6, I believe. I think you ride unlimited rides. The fair runs through August 29th. That is Sunday. Yep, still looking like it's packed down there. Have you seen the parking lot the last couple of days? They are packing them in. All right, just about 30 seconds to go. Let's get right to your comments like this one from Paul. Just a shout out to the Idaho Republicans for wasting my tax dollars on making an unconstitutional law to silence people. Education is about knowledge. Let's compare COVID numbers in masked schools versus non-masked schools. It's just too bad we have to use our innocent kids as test subjects. How about something from the other side? Where'd you find this quack that just made up this study is ridiculous? There's no evidence that masks work. The study's right here, and that's a well-respected Dr. Peterman.